I was at my grandmother's house and she was cooking for me and I was not able to keep food down. We went to Jefferson Einstein and that is when I was diagnosed with colon cancer.
I was diagnosed with ulcerative colitis in my early 20s. 2024, I had my routine colonoscopy. That was the day they told me that I had colorectal cancer.
I remember exactly how the room was. It was dark, it was cold, and this doctor walks in and sits down next to me, puts his hand on mine, and says, "We think that it's Hodgkin's lymphoma." I broke down crying.
I am a citizen of the Chickahominy tribe. My breast cancer diagnosis was revealed by an annual mammogram.
We found a lump right on the palm of his hand. After a few days of it not going away, we took him to the doctor. We were told that he had myoepithelial carcinoma. Our oncologist had never heard of it.
We have seen a lot of progress in reducing cancer disparities, but we still see that there are many populations that suffer a greater burden of cancer. Many of the disparities that we see in our populations are driven by biological factors. Many are driven by social determinants of health, like access to healthcare, access to healthy foods. One of the great promising things that we're seeing right now are more and more studies that are trying to integrate all these different drivers of health disparities.
He said, "I'm afraid it's some type of blood clot or cancer." I turn around to my mom and I look at her and I say, "What?" One of the doctors did say acute lymphoblastic leukemia. It rocked my world. I went to Providence St. Vincent's in Portland and started chemotherapy there. Then I relapsed. The first heartbreak was hearing that the cancer's back. The second heartbreak is hearing that the trial didn't work. My third option was CAR T cells. We had to go to Seattle Children's Hospital because that's where the CAR T cells were available. I was more worried about relocating to Seattle than the actual treatment.
I was diagnosed with AL amyloidosis in September of 2021. Unfortunately, they didn't treat amyloidosis in Rapid City. Shortly after that, I started treatments. I had to be at Mayo in Rochester, Minnesota every 2 weeks. It was 680 miles away. We worked it out so that I drove almost halfway to Chamberlain, South Dakota. And then they provided the transportation assistance from Chamberlain to Rochester, which I needed. I couldn't have done it without it. It was just too much. After about 3 years, it was working. They took me off of my last chemo shot.
There are citizens of the tribe who do not have transportation. So I can see how living in the area that we live in would most definitely impact access to care. I had radiation and it was in the form of brachytherapy. It's a much shorter treatment. I was able to complete in 3 days. I wanted to go that route because I wanted to continue to work while I was in treatment.
We realized, why are we trying to get second opinions from some of these folks who've actually treated MEC? Let's actually go to them. It was at that point that we picked up our lives, moved from New Mexico to California.
I remember being scared. I remember thinking, was I gonna die? If I die, who's gonna take care of my boys?
So I first found out that I had hepatitis B when I was working in Corpus Christi, Texas. I went to see a hepatologist. The liver was cirrhotic. That's when I started getting treatment for it. By suppressing the virus, that has enabled my liver to regenerate, and there's no more cirrhosis. Everyone in our family was hepatitis B positive. My mother's 3 brothers had died of liver cancer, and they were hepatitis B positive. In the Asian community, we don't like to talk about our health deficiencies. The problem that we have with hepatitis B is the lack of awareness.
One of the aspects that contributes to cancer disparities in the US is lack of utilization of cancer screening. One powerful strategy that has proven to be successful is to have community navigators. They disseminate information in their communities, they incentivize people to get screening, and they help them by providing information about where they can get screened, how to get the follow-up care they need.
I am Pastor Rhonda. I'm the founder of Celebrate Life Cancer Ministry, diagnosed with inflammatory breast cancer in September 2001. Turning this journey into advocacy, it fell on me. You know, when you're in the chemo room, you're meeting people.
Yes.
And I just decided to just have us all start getting together. And before I knew it, we were meeting on a monthly basis.
When I was diagnosed, I just started talking to men everywhere I went. I mean, everywhere. And to my surprise, most men that I spoke with didn't want to talk about their issues. And then it was suggested, why don't you start an organization?
A couple of things that our community is facing has to do with the system. I think that the referral process is too long and too hard.
Once the referral is approved, you have to contact the office, make an appointment, and then the appointment could be a month or 2 or 3 down the line. That's too much of a wait time.
We as queer and trans individuals need more affirming care providers.
After learning that virtually nothing was known about MEC, we did the only thing we knew to do, which was start a nonprofit foundation to eventually find a treatment option for SEBAS, but in the long run, find a cure for all children and adults with MEC.
For all of us around the same age to be running into the same type of cancer, there's an issue there that has to be researched. Knowing where to start, it comes from research. It comes from funding for that research.
We need more funding to continue doing research so that we can understand why some populations have higher rates of cancer compared to others.
Making research a national priority for cancer is extremely important. Please do not stop the funding. Please do not stop the research. It is vital